Hello and welcome to my vlog, Skills versus Capacities in the Weight Room Activities for SAC 7001. Due to contractual reasons, I am not allowed to use any of my athletes to this video, so my co-workers were the examples that I used. Movements I chose were the back squat and the deadlift, and we will go through major points highlighted in each lift, an assessment, corrective exercises when necessary, movement execution changes, and some final thoughts at the end. The first case we have is Claire. She's a chiropractor, a triathlete, with no history of complicated injuries and no lifting experience. In this slide, we can see a side view of her back squat. And here we have a posterior view of the same movement. The major points we can see in this view are that she's unable to reach depth in her squat, that she presents an excessive forward trunk lean, that her knees do not pass the toes, making the center of mass going forward and almost outside of her base. In the posterior view, we can see that there's a slightly shift of her pelvis to the right side, and it's possible to observe the lack of depth that she also presented on the side view. To understand that this is a skill issue and not a capacity issue, we evaluated ankle mobility, which had no issue whatsoever in both ankles, and the same when assessing the hip with a standing active hip flexion and a passive rockover flexion, where she's able to reach and have enough movement on her hip. In order to improve the back squat, we used the goblet squat as a way of allowing her to reach depth and understanding how to execute the back squat. And we can see here the changes on her back squat after doing some goblet squats. She's able to reach depth, maintaining the center of mass in her base and allowing the knees to pass the toes without increasing forward lean trunk. The second case is Heath Ledger. He's a strength and conditioning coach, an ex-rugby player with a history of right ankle injuries and 8 years of lifting experience. In this slide we have a side view of his back squat, and here we have a posterior view of the same squat. From a side view, we can also see that he has some trouble in reaching depth and that the bar path rotates to the left side, creating an imbalance, making the center of the mass also dislocate to the left side. This shift to the left side is even more pronounced when we see the movement from a posterior view. We can see the trunk dislocated to the left side and the right ankle lifting out of the floor. Knee to wall test revealed a lack of ankle mobility on the right side, which can be related to the previous injuries the athlete had, and the hip assessment did not reveal any problems in reaching depth, and his active hip movement is also above 90 degrees. In order to improve his back squat, we used an ankle mobility drill using a kettlebell with 16 kilograms in dip flexion to try and increase the range of motion of the right ankle. You can see here the changes on the execution of the back squat. He's now able to reach depth with his back squat and also reduced the shift to the left side, although still maintaining a slightly forward center of mass. The next case is LeBaron, a strength and conditioning coach, ex-basketball player with a history of back pain and 5 years of lifting experience. We have here a side view of his movement and a posterior view. From this view, we can see that the athlete raises his hips way too early in the lift, also increasing the extension of his cervical spine before executing the lift. From a posterior view, we can see this hip raise before the lift being executed and a right ankle rotation to the right side. To assess his physical qualities, we start by using the active straight leg raising that revealed no issues, and the same was shown by the seat and reach test. We tried to correct this by using a dowel and making him slowly raise it to coordinate the movement between the hips and the shoulder. Unfortunately, he still gazes the ground and the shoulder is behind the bar. We can see from this side view a change on the execution of the deadlift. He is able now to coordinate the hips and the shoulder movement at the same time for the raise of the bar, but he still gazes the floor. Last case is Fred. He's a strength and conditioning coach with a history of back pain, 3 years of lifting experience, but he's not been lifting consistently. This is a side view of his movement, and here we have a posterior view. The major points we can see from this side view are the rounded back, the hips too high, the bar path far away from the body, and the lack of latissimus dorsi engagement. From the posterior view, we can see the inversion happening in his feet and the difference in the handling of the bar. The active straight leg raising test revealed a lack of posterior chain flexibility bilaterally, which was confirmed by the sit and reach test. The thoracic extension qualitative test revealed also a lack of thoracic extension, which can be related to the rounding back we saw on the deadlift execution. And the thoracic extension related to a latissimus dorsi lack of flexibility will reduce shoulder flexion, as we see here. We have here one example of an exercise we can use to increase this thoracic extension and increase this latissimus dorsi lack of flexibility to improve the deadlift. And also using a towel under the armpit to create an engagement of the lats, allowing the back to be straightened. Using these exercises and also reducing the range of motion, we were able to decrease the rounded back the athlete presented in the first deadlift we saw, although we still maintain a bar path far away from the body and the shoulder still in line with the bar. As a conclusion to this presentation, it is important to understand that the successful execution of a technical skill is often underpinned by a number of physical capacities the athletes present. The process of developing a skill may require the S&C coach to establish if the limiting factor is a physical or a technical limitation, or both. It is important for the S&C coach to have an excellent understanding on the technical model for the execution of the skill in order to improve the athletes. And of course, a systematic assessment process is vital for establishing whether it is a physical or a technical limitation that reduces the quality of the skill execution. Thank you for your time, and I hope you enjoyed this presentation.